And I think we are ready now to receive our speaker on stage. So I welcome Aneta Tyszkiewicz, who is coming from the European Federation of Pharmaceutical Industries and Association FPA. Tobias Siebersan from FH Europe Foundation. Jim McLaughlin from Ulster University from Northern Ireland. And Michael Short from UK Telecoms Innovation Network Advisory Board. So we have our speakers with us. And just one word still of the introduction of the session. Of course, we are in the pivotal moment right now when there is lots of different shifts in regard to demographics, democracy, and obviously digitalization. And world is changing at the rapid stage in front of our eyes. Of course, pandemic helped us to refocus, but still the changes of that magnitude are happening all the time. So this is where I would like to bring this discussion forward. But starting, I would like our speakers to actually introduce themselves very shortly and tell us what perspective they're bringing to this discussion. And I think, Mike, I will start with you, and I will join you here at the...
Thank you very much for the kind introduction. It's great to be here and see so many people in the room here on Wednesday morning. So I'm a former chairman of the GSM association that runs this event called Mobile World Congress. I started the Innovation Awards here at Mobile World Congress some 30 years ago, and they're being marked as the GLOMO Awards later on today. But my other work has been in telecoms for 30 years and also chief scientist in the government.
Thank you so much. Jim.
Yeah, so my name's Professor Jim McLaughlin. I'm Ulster University. I'm director of NIBIC, which is a bioengineering centre, and I'm also setting up a new digital healthcare technology centre. I have a background in developing digital tech sensing technology and the whole med tech stack, and also a background in innovating companies. Companies like HeartSign and IntelliSense would be companies that I managed to start that are very much in the digital health space, so I have some experience of that innovation process.
Thank you. Tobias.
Good morning, everyone. I'm Tobias. I'm originally a biochemist and immunologist, did cancer research originally, and then moved into the healthcare innovation space, have worked there for 15 years with ministries of health, World Health Organization, startups, investors, and today I'm very happy to represent FH Europe Foundation, a patient organization working in the cardiovascular lipid space, since I have one of those genetic risk factors myself, and happy to provide a bit the patient perspective related to innovation, digital health, and healthcare.
Brilliant. Thank you so much. And Aneta.
Thank you, and good morning, everyone. I represent the European Federation of Pharmaceutical Industries and Associations, shortly known to you as FPA. We represent over 2,000 companies operating in Europe of all sizes, and my particular role is focusing on aspects related very broadly to data from novel sources, to generate evidence that can help us in delivering transformative therapies, as well as the use of artificial intelligence to optimize very complex processes related to drug development. And I'm very glad to be part of this, which I hope to be a very interesting panel. Thank you.
Sure. Thank you so much. And before we actually go to the panel, before we go to the discussion, I wanted to ask you, and this will be a very simple process of raising hand. I wanted to ask you, what do you think, which of those three Ds, democracy, demographics, and digitalization, will shape the digital health in the next 5 years? And I think this is like, this might be a multiple choice voting, but it would be great if you decide on your 1D. So which of the 3D forces will shape the future of digital health in the, 5 years? So who is for the democracy? Okay, we have 1, 2. We will ask our speakers later. Okay, so democracy. What about demographics, aging society, immigrations, changes in the, okay, more. And digitalization, right, this is what I expected. I will ask our speakers to comment on that, and I will also ask you later to comment on your choices. But now I would like to ask my colleagues to bring one slide that actually presents some futures of digital health that we as the ECH Alliance, we develop different future scenarios when working on one of our recent projects, Connecting Health. Here, what you see on the slide are two key uncertainties that we, based on the interviews, workshops, literature review, identify as the key driving forces for the future of digital health. So what you see here are the enabling policies, low, high. Will there be enabling policies? And then the users' empowerment, low or high. Will we actually empower our users, our patients, our healthcare professionals to use the digital technologies? And around those two axes, we have 4 scenarios. I will not go through them in detail. Later, I will also tell you where you can find more information about this work, and it's published. But we have this scenario called Digital Health is Health, where we have enabling policies and where we have also the high user empowerment. Digital Health is Health means that the digital is healthcare, it's embedded, it's integrated. We don't actually have to speak about digital health anymore. And of course, today we just received the information that the European Health Data Space regulation is finally published. So this means that I think in 20 days it will come in force. So this is really a defining moment. So I would like to ask my speakers then, based on the scenarios that are in front of them or behind us, and what our audience said, that we have the digitalization, then demographics, and then the democracy are shaping the future of digital health. How does it look from your perspective? What would you like to highlight in this discussion? Maybe I will start from you, Aneta.
Yeah, absolutely. So I will start by saying that for me, these are definitely some forces, factors that might shape and hopefully lead to a well-functioning healthcare systems, but they fall in different categories. So the first one is democracy. For me, this is a political momentum, actually, and I will refer to what is actually now happening in the European Union, and specifically the fact that in the new mandate of the European Commission, the competitiveness has been particularly identified as a core to its business. And by that, we also need to look at the investments in scientific research, in innovation, and by innovation, it's also application of innovative solutions. So that's, for me, it's the first important factor here. It's whether we do have a political momentum in order to start even implementing, upscaling, and creating an environment that allows to flourish also the startups, right, that are having these ideas, and whether they are able to upscale them, whether they have access to venture capital, etc. So that's one thing. Another thing is demographics. So, I mean, as I think it has been said probably at already many other events also during that Congress, that we have observed the aging society. Lately, I mean, actually last month, the OECD has published a survey where they monitor the patient-reported indicators of their sort of perception of the functioning of the healthcare systems. And as a result, the results showed that over half people that are over 45 years old have 2 or even more accompanying chronic conditions, which means that we need to create a system, obviously, that would empower them to also manage their diseases in the long term, and they have this kind of iterative interaction with the healthcare professionals. And the last thing is digitalization, for me, is an enabler. It's not a force, it's not an end goal. It's an enabler that has to be exploited if you are about to address the current challenges we have. Meaning that we truly address the fact with the aging society, that we also relieve the sort of the burden from the healthcare systems and increase the productivity. So I would really see them a bit, I would say, differently in terms of how they would influence the future policies in healthcare.
Thank you so much. And then Tobias, you represent here in this panel the voice of the patients or patient's perspective. So how does it look from your perspective and the uncertainty about the user's empowerment and also in terms of demographics, how we can pair it so that we actually empower all users and we don't leave anyone behind? I'm thinking here also about the older population.
Yeah, well, if we take an example in the cardiovascular space, and which is now very relevant with the European Cardiovascular Health Plan, and several countries like Czech Republic, Germany are thinking about national cardiovascular health plans. Right, there is just an incredible slow speed of bringing things to patients. So, for example, if I can ask you here, who of you knows what lipoprotein A is, and who of you knows what your value is? Right, then we see one hand, right, which is brilliant. So why am I asking that? The medical guideline of the European Society of Cardiology said already in 2019 that every single citizen should get their lipoprotein A value measured once in their lifetime. And now we are 6 years later, and in pretty much every European country, if we don't take Austria into account, we have about 1% of the population tested. And in a country like the UK, my wife is from the UK, and I know many patients there, they go to NHS doctors who then say, well, I'm not testing your lipoprotein A level because we think it's too expensive. And then we have people with the age of 36, 37, 38 having a heart attack out of the blue because they have sky-high lipoprotein A levels and they got never tested. It's a genetic risk factor, by the way. If you have it high, you will always be high. And the value will be stable when you are sort of 9 or 10 years of age, and then it will be stable till the end of your life. This is not acceptable to me that 6 years after the European Society of Cardiology published that medical guideline, we are absolutely nowhere in testing people. Right? And this month there will be a publication in the European Cardiovascular Journal that it is actually cost effective from a health system perspective and beneficial to have everyone tested between the age of 40 and 60. So therefore, right, it would be quite easy from a digital perspective. You could use digitization to update how diagnostic lab tests are done, right? And if you are my doctor and I come to you, then you can say, oh, Tobias you get a flag, right? Tobias has his lipoprotein A not tested, and then you just do an extended lipid profile, right? Not just LDL cholesterol, but also lipoprotein A and apolipoprotein B, and then it's done, right? It's as simple as restaurant table booking, right? So in that sense, there is a lot that needs to be done, right, to actually have patients empowered and bring them to the table.
Thank you so much. And you said that it's very slow and in some cases also expensive. I wanted to ask Jim and representing academia and innovators, and also Mike representing industry and innovators from their side, what to do to make sure that actually we bring those innovations to patients and users faster without compromising quality and, of course, healthcare outcomes. What's your suggestion? What's your response?
Yeah, no, it's a really, really good point. And I've lots of experience of the slow bit, particularly the innovation cycle. First of all, I would say it's an extremely complex area. I mean, I developed what was called a medtech stack to try and talk to companies and to try and communicate the issues. The medtech stack is extremely complicated when you think of a concept right through to demand and need and demographics and cost, as you say, and time, etc. So, I mean, for instance, we've looked at ways of speeding that innovation process up by creating clinical living labs and putting them into the hospital system to get rapid feedback, to really look where the demand is needed, etc. But you know, there's still many bits to that complex piece that but particularly as AI slips in now to a lot of algorithms that are important for that decision-making bit. And I should say also that, you know, it is complex. There's digital systems that are sort of playing out in my own country. We've just introduced Encompass, a bit like Estonia. We've digitally empowered the healthcare system right through to social care. So it's a very powerful system. And we're going through the piece at the minute of empowering the patient in there and getting patients in to build up trust with this technology. So that technology has to be pretty robust. And it's a lot about appointments at this stage, consultations, medical records, and trying to build that trust bit up. Now, where tech then will start to make a difference, where I see it making a huge difference, is when it becomes clinically relevant data. So what that immediately does then is allows clinicians to make decisions based on real data sets, and then it changes workflow. And that's what we all want in hospital systems, and that's where we'll see a huge difference when waiting lists, etc., are addressed and when workflows addressed. That benefits patients, it benefits clinicians, and gets to your point about cost. It starts to reduce costs and possibly helps patient safety, you know, and really addresses the major issues in there. I have seen really, really good developments in the wearables. I've been in wearables for about 20 years. I would not claim to be a fan of wearables for many years, but I've seen dramatic changes in wearables in this last 2 or 3 years. And a lot of it, believe it or not, is down to simple things like battery life. I'm wearing a blood pressure monitor here that lasts 3 weeks. That's what you want for an aging community. Robust solutions that do make a difference, and trending data then that becomes clinically relevant.
Okay, perfect. Thank you so much. What about your view on this, Mike?
Well, I'd like to link democracy to actually technology in a different way.
Okay.
And I think we can see with mobile, it's the most widely adopted technology on this planet today. With more than 1.4 billion smartphones being shipped every year. It gives more access to the internet based on access than any other technology. So that's democratizing the access to information in a way that the health services have not traditionally kept up with. So it's not just a world of apps, it's a world of information where you can have much better access. When I think about the mobile camera phone, for example, being 25 years old last year, and how that's opened up a world of social media and information sharing, it's not just the apps, it's not just the digital health systems, it's how is technology enabling, as was said earlier on, so much more ways of dealing with things. But what we can see is that the mobile community are beginning to look at digital diagnostics, not just for the consumer, but also as an aid for clinicians, as an aid for patient pathways. The ability to plug in microscopes in a remote field in Africa that then work via a mobile phone to send results. So it's very important to have a systems view, but also know what the key elements of digitalization are, whether it's wearables or apps or maybe the systems that are built on those sorts of things. To me, the other key D is demand. And there is growing demand where the technology can help address that demand, whether it's a demand through aging or new discoveries of diseases, patient concerns. The prevention story, I think, will be in the hands of the consumers. I don't think the prevention story is entirely in the hands of the clinical professions alone.
Thank you so much. Thank you for those comments and perspectives. I wanted still to come back to the European health data space, as also this is another defining point in our journey, digital health journey. So it's been published, it's here. Most of us see it as a great opportunity, but of course there are some voices like, do we need that much regulation? Coming back to this political momentum and the democracy, I wanted to ask you also, how can we balance the need for regulation with the innovation? And how would you also, from your perspectives as the representative of patients, academia and industry, would like to see the future of that, not only in Europe, also globally? Yeah?
Yes, so today is indeed D-Day when the HDS finally was published in the official journal on the European Union. I can say that from the perspective of the research-based industry, where data is critical to all what we do, from identifying trends to testing hypotheses, developing the treatment, monitoring its performance in real life, it is all very much dependent on the availability of data. And it has been recognized that there are significant limitations coming from the data generated in a strictly controlled environment. Hence, the proposals such as European health data space that not only empowers patients in terms of giving them the ability to control how their data is being used, with whom it's being shared, but also it aims to build a digital infrastructure that will foster the deployment of digital services. But from our perspective, the most sort of important added value would be the consistent framework allowing to access the data for secondary purposes, including research. The goals are very ambitious, and definitely the member states would require sufficient support and funding in order to make that happen at the national level. And the devil is always in the detail. The final text of the HDS does not define at the sufficiently, I would say, detailed level on when it comes to the interpretation of key provisions. As a pharmaceutical industry, we'll be a data holder and a data user. The impact on our sector would be enormous. And the companies are rather diligent, started already preparing for the implementation of that proposal. However, they do not have the details needed to understand what are the rules, what are the expectations from them. So we now focus on actually engaging with the European Commission, with TEDAS, which is a joint action on European health data space, to understand of how we can further define these details to make sure that we are not duplicating them, that we are not contradicting what are already well-functioning, I would say, approaches. So I would say that it's still yet to be seen to what extent that actually delivers on its promise.
Thank you so much. Mike?
We wouldn't all be here at Mobile World Congress if we didn't want to learn from each other. But this whole industry called mobile in Europe started with the European Commission pulling together the leading operators and vendors back in 1987. So if we go back 38 years, there are lessons that could be taken from there, which was saying this can be implemented in the following way. And I think what you've just described is some of the things that we did back in 1987. We said, we'll all use the same spectrum or radio waves. We'll all launch at the same rough date. We'll make sure the cities, the capitals, the airports are covered first. That was the foundation for standardization. And I think the implementation needs those specifics to be clear to a wider audience to make it a success. These are implementation issues which the European Union has addressed before for the mobile industry back in 1987.
So we can learn from that example, which was successful, I assume.
Yeah,
Jim,
I'd just like to fully agree with Mike, and I sort of remember those days. I mean, I've sat in these panels for many years with topics like interoperability or access or whatever, and you know, the mobile phone platform, particularly the mobile platform, has changed so much. But just thinking back, COVID was a really interesting time from the point of view that regulatory loosened up a lot, and we went in probably with wearables for the first time to look at many very, very specific disease issues, and worried a little bit more about the regulatory piece after that. So the one plea I would have, because regulatory bodies do come up with, you know, conformance standards that you have to apply, and we talk about cardiology or wellness or whatever it might be. Once you get into detail, it can cost a company 5 or 6 years of development time if rules change. I mean, so we're moving into AI, we're moving into the world. I mean, the only way that you really help workflows is decision-making algorithms in there. So normally regulatory bodies want to know the ins and outs of a decision-making algorithm. So that's fine. But once we apply AI and that black box starts to work with AI, that's what I fear. So I would really appeal for as much detail when we start to bring in the world of AI and algorithms into decision making and break it down per disease group. And I think that's very, very important because cardiology, wellness, and many other areas will require different things like sustained times or statistical processing will be required to be different in each one. So I appeal for detail in standards to help small companies and innovation companies get there and get to the end point as quick as possible.
Thank you so much. Let's now switch to demographics, and obviously we know that the younger generations and the older generations work with or use the digital solutions differently. I'm wondering also how the healthcare systems can adapt to those changes and how they can make sure that also the young generation is benefiting from the digital solutions, something that they know many from even the early years, but also that the older generation is really like not falling behind. How we can make sure that the healthcare systems are actually adapting to both of those realities. Do you have any? Yes, Mike?
So clearly we're all of different ages, but we need to learn from each other. So I started when it was something as basic as SMS and texting in the UK, a campaign called Teach Your Mum to Text. How can teenagers teach their mums to text? And then we had a texting and SMS boom because of that. That cross-generational experience is very important for healthcare as well. Yeah. So how can the younger audiences teach their parents about ways in which they can do things in a digital world? Not just does the PC work with Wi-Fi, but how can they actually help in that area? I think the Estonian initiative about training people in schools about digital is a key part of this. How do we start with the young so they can help the more elderly, if I can put it that way? And I think that will open up eyes to information sharing with apps, or information sharing with wearables, new approaches. I think it can be coupled with things like, why don't we have connected hospitals or digital hospitals which have the capability to transfer the information within a hospital more readily and then work with outside communities beyond the hospital. If a hospital is better connected, it can start to work better within the hospital and to and from the hospital. So we need to use the enablers of education and the health system to help with the digitization.
I remember a couple of years ago I discussed this issue of Estonian success with colleagues from the country, and they said it's not about digitalizing healthcare, it's actually digital society. So it's also, of course, elections and all other parts of life are digital, and then the digital healthcare becomes a natural part of life. And I think that you bringing us back to the early ages of mobile technology and how this spread is also a very good reminder that we went through this, and we actually can learn a lot from that example. Jim, you're raising your hand, and actually, I also wanted to ask you. You said about you gave the example of the innovation labs in the hospitals, and I wanted to ask you if we can learn something from Northern Ireland in that area.
Yeah. So I'll touch on that in a second, but I think with the youth of today, there's a trust thing that has to be built up with data and our health service, but you know, I don't think that's where the big problem lies. The big problem lies with the aging community, and there has not been any good health tech solutions in that area. I mean, ubiquitous computing in the home has been attempted. In Europe, we spent millions on projects over many years trying to create the smart home. And I look at a lot of studies in that area, I don't see anything overly successful that's making a difference in that. And as heart failure is one area that's growing out of all proportion as an epidemic and as a problem, we haven't found a way of treating that. So the only solution that seems to work is where social care comes in to being as part of the system, right? And many countries do not fund the social care piece correctly and do not empower that community with digital tools to really help with the aging Not every country, as I'm finding out over these last few weeks, not every country has a social care system either, you know. But it's that treatment of the aging at home where a lot of our issues are. Yeah, I mean, our experience has been really dramatic, rapid innovation when you do it in the environment, right? So if it's a community or a GP surgery, or in the case of the clinical hospital, we find champions that are coming then from the clinical side that really motivate and champion the technology through, so trials happen much faster. The real need, I've always said, in respect to any clinicians that are in the room, the way a clinician behaves in the boardroom is very, very different to a patient with scrubs on, right? I have been told off many, many a time for silly ideas in a hospital theatre, but those ideas have been put up with in a boardroom. So it's that real environment with raw data sets, usability studies, etc., that make a big, big difference to rapid innovation.
And we're talking about digitalization here, I think, from the first minute. But now, going through our 3Ds, I would like to actually focus even a little bit more on the digitalization, and just have a very, very simple question to my speakers, and maybe I will ask Tobias to start. If the digital health is actually, or digital is actually closing gaps or creating new ones, and how to make sure that we actually don't lose the certain group of population while advancing on this digital path in healthcare.
Well, I would say we have a massive opportunity now to go from our current health systems to what I would call digitally enabled health systems. And to your point, Jim, right, we just need to get beyond the point solution. So what we need, and what now some countries are moving to, is that we need a few enabling pieces like electronic patient records on national level and e-prescription infrastructure, which in countries like India are set up as digital public infrastructure, and there are different ways how to do it. They are the foundation of the house. And then we need to build 4 pillars. One pillar is digitally enabled prevention. There we need to bring together things like better sleep, better nutrition, better fitness, better stress management, and ideally it needs to be fun, because otherwise no one is doing it, right? Then the second pillar is digitally enabled acute care. If I'm run over by a bus, that then there are patient portals, that the data is there, that then the surgery people can stitch me back together. The third piece is digitally enabled chronic disease management, given that 40–50% of our populations have chronic diseases ranging from heart failure to diabetes. We need then things to help those people with sustainable behavior change, with weight loss, etc., chronic disease monitoring, submitting data. And then the fourth part is, and now since COVID is over, a bit easily forgotten, right? Disease surveillance and pandemic preparedness in a digitized way. In the same way as we are forecasting weather patterns, we can forecast pandemics if we get towards it. These would be the 4 pillars of a digitally enabled health system that I would see. And if we are getting there and integrate that, to your point, with social care, right, we don't have problems then in the end. Pretty much everyone, whether they are 20 or 85, are able to do mobile banking these days, and pretty much everyone has a mobile phone, to your point of view, right? So I think the moment we make it easy for people to do that, and in healthcare we ideally also make it fun, then people will actually do it, and there will be not a digital divide.
And I think I could ask you now the question, all of you, how to make it happen, and of course, like, to open this. But we have just 5 minutes to go in this session, so I'm afraid to ask this question, because that could be the whole day discussion. But I think that we will also unpack, of course, those steps, how to make this happen, so that it's we have that digital health is health during the whole day. One more question to you, Aneta, on coming back still to the EHDS and following up on those gaps and opportunities. Now with the EHDS in place, and then of course all opportunities coming from the health data, like, do you think that the health-driven healthcare will finally be a reality, or those infrastructure gaps and the issues related to the health literacy or digital literacy will actually hamper this process and will derail this process?
Well, I can answer quickly that it depends, because Europe processes are well known for being rather heterogeneous and slow. So I guess it really depends to what extent the countries would be truly able to apply harmonized approaches during the implementation of the European health data space. But also it's up actually to all of us, to all stakeholders, to make sure that we create a system that merits patients' trust. So as you might know, in the European health data space, there is a possibility to opt out from their data to be used for secondary purposes. This might have a detrimental effect on the scientific research and might deprive us from access to the representative data, and after all will not fulfill the expected objectives. We see HDS as a vehicle to generate evidence and fill the gaps in the areas where our knowledge is non-existent or not satisfactory, in the therapeutic areas where currently we do not have a therapeutic options. So this is a great potential. However, if the patients do not trust the system, if the member states follow their own approaches, we would not succeed. And that also needs to be accompanied by sufficient funding to address the different maturity level at the member states. So that has to be really, I would say, a holistic approach over years to see the benefits, as well as we'll see whether HDS would still enable also international cooperation. There are some additional safeguarding mechanism added when it comes to data sharing outside of Europe. Again, for the purpose of scientific research, I think this is really a paramount that we are able to advance our knowledge and do not duplicate processes. But if we move towards more protectionism, we will never achieve that goal. So there are many, I would say, aspects to still bear in mind.
Yeah. Thank you so much. And actually, I have now the question for you, very quick question. Like, is there anyone who thinks that actually that digital is creating more problems related to, for example, infrastructure gaps or this issues related to also training and so on, that's solving? Is there anyone in the room that thinks that actually digital is creating more problems than solutions? No one? All right, this is very optimistic and very good. So for the closing of this session, I would like to just do a very quick rant with the speakers, if they can give me one prediction on the digital health in next 5 years from those perspective of not 3Ds but 4Ds. So we had democracy, demographics, digitalization, and then Mike brought us also the demand. So we have 2 minutes to go, so half a minute per speaker. If you could give me one prediction about the future of digital health. Okay, Jim, we can start from you.
The future, right? Okay, so I mean, I think from a national level, I think putting in systems like the electronic care record is absolutely essential, and getting single data systems. And then coming on the back of that, the type of things I see making a big difference is symptom checking apps, you know, that have real data empowered into it to really help workflow systems. I think you'll get huge buy-in from we call them trusts in the UK, but buy-in from the senior staff within the trusts of hospitals that work right throughout the system. So that's what they're looking for at the minute, is ways of reducing costs, improving patient experience, and I think it has to be something that addresses the workflow.
Yeah,
you know?
Thank you. Tobias?
Well, my hope would be that that ministries of health and health system move towards paying for digitally enabled care pathways, where then several things that are today either paid for or not paid for as point solutions are coming together, like digital therapeutics, digital diagnostics, patient remote monitoring, etc. They are all different categories today. Some paid for, others not paid for, and therefore it's just such a mess, right? And so if we would get to those care pathways where then, let's say, to your point, Jim, a heart failure patient has then 5 different solutions working hand in hand, that would be a major improvement.
Aneta?
Yes, well, I think that we need to apply the innovative solutions when they truly add value, while at the same time we have the safe space and where we can discuss together on the right approaches. From our perspective, we can apply, for example, innovative approaches to make sure that the patients have a more active role in the clinical trials. Some patients would not have access to the innovative treatments if not, for example, the remote services were not provided to them. We can gather the insights that matter to the patient the most. But the question is, we can do that, but whether then the regulators would accept these outputs. That's also another question. That's why the importance of working together at the early stage to have an agreement on the appropriate methodologies and approaches to ensure the robustness of these results, of the outputs generated thanks to the digital solutions.
Thank you so much. And the last word to you, Mike.
I would just like a clear plan that we can all understand and implement by 2030, embracing infrastructure and some solutions against it. You know, some of the work I'm doing on AI for dementia could be a nice example, but I'd like to see a clearer plan that's not purely condition-based, but is system-based. Platform for 2030 for Europe.
Brilliant. Thank you so much. Let's work on this together. Thank you so much to you, Mike, Jim, Tobias, and Aneta for joining me at the stage today to discuss the 4D forces that are shaping the future of digital healthcare. Let's join me in the round of applause to our speakers.